Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. Karen Litzy here, your host, and in today's episode, I am so excited that co-host Jenna Cantor is back, and today she is interviewing Dr. Tameka Duncan. Dr. Duncan is a licensed physical therapist in Clarksville, Tennessee. One of her greatest passions is physical therapy. She loves fostering change through preventative and rehabilitative services. She takes great pride in helping restore a patient's quality of life and improving their overall function to return to the things they love doing most. Dr. Duncan attended Howard University in Washington, D.C., where she obtained her Bachelor of Science degree in health science with a concentration in pre-physical therapy. She later went on to attend the University of Maryland Baltimore in Baltimore, where she obtained her Doctor of Physical Therapy degree. She has worked in a variety of settings throughout her practicing career. She spent 8 years in the outpatient orthopedic setting and recently transitioned to the home health setting while starting her own mobile physical therapy practice, Vitality Sport and Rehab. Her area of specialty treatment is the spine, to include both the neck and the back. She obtained extensive training in the McKenzie method of mechanical diagnosis and therapy, obtaining her MDT Certification in January of 2007. Dr. Duncan is also very experienced and enjoys treating various injuries sustained by the young athletes to the aging geriatric. And in today's episode, she and Jenna are discussing those young athletes. So they're going to be talking about treating the high school athlete. So if this is a demographic that you're wanting to get into, this is a great episode to listen to. So they talk about why Tameka is passionate about working with high school athletes, the experience needed to treat that population, and how Tameka has established expertise and rapport with athletes in her community. So a big thank you to Dr. Jenna Cantor and Dr. Tameka Duncan for a great interview. So everyone enjoy.
Hello, this is Jenna Cantor here hosting for Healthy, Wealthy, and Smart. I have the pleasure of interviewing Tameka Duncan, who is the owner of Vitality Sport and Rehab. And today we're going to be discussing providing physical therapy for high school athletes, which I think is incredible because you work with high school athletes regularly, correct?
Beginning to.
Oh, that's even better. So I love that because I know how passionate you are about working with people in sports, and you've been putting out questionnaires and stuff to better get to know this specific niche. And I honestly love the fact that you are a woman as well going for this, to say that you wanted to go with athletes. So I thought you would be a very powerful speaker on this podcast. So first of all, so what inspired you to pursue a career working with high school athletes?
So I think for me, I was a high school athlete, and it was just that time. It was very impactful for me, just being around a team, being with coaches, and then when I had injuries, getting rehabbed. But just remembering how impactful that time of my life was.
Yeah.
And then even when I would see these athletes coming to the clinic, it just kind of took me back to that time. But I've always just had a heart for that age group, that teenage age group. So it's just a group of kids. It's just, I'm passionate about them. And I think that because that's a formative age of life and time of life, you know, I feel like I can not only provide physical therapy to them, but just inspiration, motivation, just for that time period of their life. So it really kind of just merged my career for physical therapy, but my heart for that generation of young people. So it kind of just naturally developed. So
That's great. They're going to be really lucky to have you, especially because you have that specific heartfelt connection.
Yeah.
I love that. So for your niche, what do you think a physical therapist should bring to the table for experience to better help these young athletes?
I definitely think, of course, some type of knowledge regarding whatever the sport is. You know,
Right.
I specifically, like I said, I'm just really beginning to dive into that really with my emphasis being focusing on the high school athlete. And the area that I would really like to focus on is the track athlete. So I definitely think whether it be track, basketball, lacrosse, baseball, I think definitely a knowledge of what that in sport tells. And I would assume that that person, that PT would have probably been a former athlete, so they'll have some familiarity with it. But definitely a knowledge of the sport. And then, of course, some continuing ed classes such as SFMA. That's something that I'm actually looking into taking that course.
It's a great course. I've taken that course. I would highly recommend it.
So I'm definitely looking to get that done over the next 6 months to the next year to really kind of just hone in on skills more specifically for that demographic of patient. But then true again, like I just said, just the heart for that generation. I think in our profession, I think it's important that people they know that we treat and we can work on the body, but when you can really connect with people, I think that's when we can make a bigger difference.
Yes.
So,
well, because you know their life, you know exactly where they're coming from, you know exactly what their mindset is when they come in that room and they have to see a physical therapist and how quickly or slowly they may want to get back to their sport, depending on the time of the season. Yeah. All these things, you know what their brain is doing. Exactly. And that is extremely helpful. So how is working with high school athletes different from your past experience as a PT?
Working with the high school athlete, again, kind of just like you just said, it's just they want to get back on the field, or, you know, they want to get back to participating in that sport, as compared to, let's just say, and this is not true for all, but let's just say your typical geriatric, someone who has just natural degeneration or, you know, osteoarthritis, someone that we're treating for that, you know, we may have to make a little bit more of a lifestyle modification for them, or do, you know, kind of alter their treatment a little bit differently. These kids, they're energetic, they're motivated. Yeah. And again, not to say that the other demographic of patients aren't, but this group in particular, they have a vision, they have a reason, and they're motivated to get back to whatever that sport is. So
they do it. They do what you tell them to do.
Exactly.
Yes.
I think that's the time where you can get them to do exactly what you want them to do.
Yes. Which is great, and it's so rewarding because you can really see them go from that injured state all the way back to them functioning fully for their sport and their overall health. Yeah. That's wonderful. So have you run into, now that you're getting into this, any obstacles being a female wanting to be involved with the sports?
You know what? Thus far, no.
Good.
I haven't.
Good.
However, that is something that I've thought about. You know, it's just like, okay, I'm kind of putting myself out there. What are people going to say? You know, so I have not run into it yet personally, but it's actually something that I've kind of thought about. But at the end of the day, if and when it happens, because I'm sure it will, you know, it may not be something that happens all the time, but I'm sure I'll encounter it. I just let my results and speak for themselves, and let my reputation speak for itself. You know? So just kind of, I guess I'll just deal with that when it comes.
Yes, absolutely. Absolutely. So bouncing off that, what do you think you would have to do to prove that you are worthy of working with these high school athletes?
I think, again, just my reputation. You know, in my city, I've been a PT there for 8 years. And so I have the pleasure, you know, I've been in the same city for 8 years practicing.
They know you.
I've built up a great reputation, which I think it'll speak for itself. And so I think when people find out my reputation, but then when they truly see that I have a heart for this demographic of patients, it's not just about, oh, okay, let me get your business, but no, I really want to see your child succeed. And I really, you know, whether it be on the sport, on the field, on the court, whatever. Yeah. I really want to see this child succeed. So I think my reputation will kind of speak for itself.
I love that. That's great. I mean, the 8 years definitely count for something. I mean, 8 years?
Yeah.
Yeah, you're like, it's been 8 years. All right, I'm just getting more specific now. I appreciate that 100%. So what advice would you want to give to students who want to pursue a career working in sports?
Students, I would say, if it's something that you want to do, go for it. You know, I would say surround yourself or connect with a PT or who's doing that to really see that it's something that you really want to do. But if that's your passion, if you're finding that, you know what, this is the area that I want to focus on, go for it. Don't let anyone tell you that you can't. Obstacles will come up all the time, but jump right over them and keep going. So I just tell them, if it's something that you are really interested in pursuing, go for it.
Yeah. I love that. Thank you.
Yeah, thank you.
Thank you so much for coming on, Tameka. This has been a true pleasure.
Thank you so much. Thanks for having me.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.